All right, this proprioception diagram. We're going to run through this and try to explain it as best I can. I will not do it as good as the guy that presented it to me because it was incredible. So I'm going to put myself up there. But anyways, proprioception. It's your sixth sense, right? It's your sixth sense. It's your most important sense because it has the potential to enhance the other five senses. Really cool how this works. So I'm just going to run through this diagram. You can see in the middle there is a makeshift brain. Okay, I know it doesn't look like a brain because I can't draw, but you can see how the brain in the middle has something that says THK. That represents think to me. That represents one of my elemental health categories that I'm always explaining to patients. However, it also represents the thalamus. You've probably heard of the hypothalamus and the thalamus in the brain. Those are different structures that do different things, but the thalamus tends to relay a lot of information to the five senses, and vice versa. The senses relay the information into the thalamus. So if you look at how this works, proprioception being the kinesthetic awareness that it is, the basically your body's perception of itself, your body's ability to know where it's at in space, is super important for helping regulate these mechanisms to a certain degree. So if we understand how this all works, it really makes a lot more sense from a standpoint of how proprioception can actually help us enhance our quality of life day to day, minute to minute. Okay, so one of the main things we're going to focus on in this video is to understand how joint stiffness can jack up proprioception, and how that proprioception being dulled or diminished can really have a profound effect on many other things that we're going to talk about. Joint stiffness, what causes some joint stiffness? We're going to start with inflammation here. So if we look down at the bottom of this diagram down here, you're going to see that inflammation can come from a number of different things. Most of the time it's some sort of physical, chemical, emotional stress. I'm thinking things like, high fructose corn syrup, flour, sugar, gluten, those kind of things that tend to be inflammatory in the diet, environmental toxins, and those kind of things that can create inflammation for our body and our immune systems. The omega-6 to omega-3 ratio that is in many seed oils and different processed foods, that tends to jack up inflammation. And we've all heard about inflammation being a huge problem, and this day and age it's like you can't go anywhere without hearing about it. It's on magazine covers and books and courses, and everybody's talking about inflammation. So, but we think about inflammation a lot of times, we think about like injuries, and if you roll an ankle or sprain an ankle, how that ankle balloons up, that's more of an acute inflammation. But these other things tend to have more of a slower grade systematic effect with inflammation that can lead to something we call fibrosis. Now when we have fibrosis whenever we have inflammation in the body, we're going to have some degree of fibrosis. Inflammation leads to fibrosis. Now fibrosis could take the shape of like a scar tissue in a joint or in a muscle, or in the areas where the joints tend to be most abundant. If you get scar tissue in those areas because of trauma, or because of stiffness, or because of infection, or just plain old not moving, can start to develop adhesions and scar tissue in the joints and in the tissues, then we're going to have joint stiffness. Now joint stiffness tends to decrease proprioception. Proprioception tends to hang out, the sensors for proprioception tend to hang out in the muscle spindles, and the muscle spindles are usually closer to the tendons in the joints, or where the muscles insert into the bones. So when you have joint stiffness, or tendinous stiffness, or muscle stiffness, that's going to decrease the body's ability to have proprioception in those areas. That proprioception is going to then dull the information going up into the cerebellum, where 80% of your brain's neurons are, going up through the cerebellum and into the thalamus, and then relaying that information out to the five senses. So by dulling proprioception, you are dulling your other five senses. Now you're not going to, just because you're stiff, all of a sudden you can't see. Okay, it's on a micro scale, and it happens over time. And sometimes it's going to be almost subconscious. Sometimes it's going to be barely even noticeable. All right, but the really cool thing that really turned a bunch of light bulbs on for me here was understanding how, one, this was presented to me, how chiropractic can increase proprioception and then therefore minimize this cascade, or at least positively impact it significantly. But then if you think about it, so does movement, so does exercise, so does appropriately programmed exercise and just moving the body. So if you look over on the side here, over here, you'll see that I put movement exercise chiropractic gives you more life per moment because of its ability to enhance these mechanisms or work on these mechanisms. So you can see the arrow coming down there right here, how these things are going to decrease stiffness, okay? And that's going to increase proprioception. Now these things in and of themselves will increase proprioception as well. So we have a two-pronged mechanism here how this works. So by doing these things regularly, consistently, effectively, efficiently, sustainably, those kind of things, you're going to increase proprioception, which is going to increase the information going up through the cerebellum to the thalamus and then relaying that information out to the five senses. That's going to allow you to perceive your environment better. That perception of the environment is going to lead to better decision making. That better perception and decision making is going to lead to just seeing more, hearing more, feeling more, tasting more, having more life per moment. That's how this presentation was given. And I was like, whoa, it hit me, right square between the eyes. And that's all information coming from a neuroplasticity researcher named Norman Doidge. He's a medical doctor. He wrote some books called The Brain That Heals Itself and The Brain's Way of Healing. There's a couple, I got them on the shelf over here. But brilliant guy. He is an expert in the field of synaptogenesis neuroplasticity. I know that's a mouthful, but basically that's the way the brain changes itself in accordance to the things that it's perceiving in its environment. It will literally change itself. That's called neuroplasticity. So, really smart guy, really brilliant way of presenting this, but I've seen some chiropractors and some other like movement specialists latch onto this concept and really understand proprioception from a deeper level now. And it's just brilliant how this mechanism is so important in the body, but also how it can be compromised so easily by some of these things. Now, it's just one of those things I want to emphasize is that chiropractic goes in there and works on some of those very specific segments. When we adjust the spine or when we adjust a certain body part or body region, we're putting input into that area. We're releasing restriction, releasing stiffness. Sometimes we're not necessarily breaking through fibrosis or anything like that, but we are definitely increasing joint mobility, and that's going to increase proprioception, the body's ability to perceive itself in that area. That information gets relayed up the chain through the cerebellum to the thalamus, out to the five senses, allowing you to perceive more. Pretty incredible.